World Health Organization has triggered the highest alert yet again. Monkeypox, now prevalent in over 75 countries, is a public health emergency of international concern. The second disease to be tagged so in 3 years. But what exactly is a public health emergency of global concern?
A public health emergency of international concern is defined as an event that requires the whole world to sit up and pay attention. It must be a disease or a health condition that is sudden, unexpected, goes beyond a country's borders and requires a coordinated response from multiple nations all at once.
The WHO's 16-member emergency committee has declared global health emergencies 6 times in the last 14 years. Of the 6 times that the World Health Organization declared public health emergency of international concern, only twice did the infection outbreak move to the pandemic stage. Once in 2009 with the H1N1 flu pandemic, the second time in 2020 when COVID-19 was declared a pandemic. In 2009, WHO declared H1N1 or swine flu, also known as Mexican flu, a pandemic. In 2014, polio virus was declared a public health emergency with an increase in cases of wild polio cases. Again in 2014, Ebola was declared a public health emergency of international concern. Same with Zika virus in 2016. Also in 2019, Ebola was again declared a public health emergency of international concern. The last time around in January 2020, COVID-19 was first declared a public health emergency of international concern and then a pandemic. But is monkeypox going to assume pandemic proportions? Will there be widespread infections and lockdowns? Should we brace for the worst? Experts say that this is not a lethal disease. The death rate is low and that this is not COVID. COVID is airborne. Monkeypox spreads through prolonged physical contact with a patient. COVID is more transmissible. Monkeypox is not highly transmissible. COVID invited mass lockdowns. Monkeypox is unlikely to lead to lockdowns. No wildfire spread expected in monkeypox. COVID, meanwhile, continues to see wide transmissions. The concern is that even though not very transmissible, the infection will percolate to the general population eventually.
Men who have sex with men, and this virus is spreading along these networks, and it's important to realize that these networks don't exist in isolation. These men could have multiple other partners. Many of them could have a regular family.
Experts also say that this is the time to change the nomenclature and ensure that stigmatization does not take place.
Stop calling it monkeypox. Declare this as a sexually transmitted infection. It is not spread through respiratory means like COVID. So the attention will be focused on sexual transmission. Currently all 100% cases are sexual transmission. 99% are male to male and 1% male to female or female to female. So in that kind of situation, we should declare this as STI.
So far, monkeypox doesn't look like causing a pandemic, but health bodies worldwide are keeping a close watch. In New Delhi, Sneha Mordani for India Today.